I would like to talk about is that even though we are afraid and fearful and anxious about getting affected by COVID or getting a disease that can potentially kill us, the solutions that society is currently coming up with to battle the coronavirus is not a long term solution, is not a perfect solution, and it's not even an imperfect solution, because in trying to solve the problem of a viral infection with a vaccine, people are forgetting the underlying conditions that are existing in any country, any city, any religion, any society that could be impacting the effect of the coronavirus in a human's health. In my father's society, I saw that there were a lot of cases of coronavirus. Whereas where I'm staying in Kharghar, it's also in Navi Mumbai. It's in the same district of Maharashtra, but even though it's or nearby district of Maharashtra, it's two different districts, but they're very similar areas and they are nearby areas. They're only like 15-20 minutes drive away from each other. But despite that, there is a stark difference in the number of COVID cases in this place versus the place where my father's society is. And why is there a stark difference? Because over there is overpopulation right now. The density of population has increased over the 30 years or so that the society has existed. The number of plants and trees have been cut down. The number of buildings have arisen, and because more buildings have come up, the population 30 years back, when there used to be hardly like maybe 200, 300 population in this particular area, that same area right now, and while the population of humans was about 200, 300, the population of trees and plants and animals likely were higher. And now it is the opposite. Now the population of that same area is probably over 10,000, and the number of trees have decreased. So there is less oxygen for human beings to breathe. Not just less oxygen for human beings to breathe, there is less number of trees to give oxygen to the increased number of human beings. So there is a exponential decrease in the oxygen availability of people living in these areas. And if you're not looking at that aspect of a demographic criteria that can impact a person's health, and you're just willy-nilly giving vaccines to people without looking at the underlying socioeconomic, societal, structural, functional problems, then you're not solving the long-term reasons for COVID existing in this society. The COVID cases were there initially. There were a few cases. Then when lockdown happened, those cases came down. But during lockdown, one important thing, one very bad thing was going on. They prevented outside people from entering the society. The lockdown also prevented people from going out for walks. Now, if people are not going out for walks, if people are not breathing fresh air, if people are not breathing, taking in vitamin D from the sunlight, and if people are not socializing and interacting with each other, how will they have long-term good health? And now those people whose bodies had likely some weakened immunity because of not just these three lack, because say someone doesn't have good family contact and their only social contact is all the friends and people they meet in the society while they are going for evening walks or morning walks, then, and if those morning and evening walks have been curbed, now they don't have a way to venture out their problems, their life issues. They don't have a place to share these problems with someone, a person to talk about and share their problems and figure out a solution to their problems. Now that is happening. So for those people, it is their immunity can get down because they're highly stressed out, because their venting system has been removed. Some people don't need other human beings to talk to, but they might need nature to communicate with. They might need just greenery and fresh air and sunlight to get the outside energy in order to feel nice and fresh and de-stressed. Some people need sports to feel distressed. So there are so many various reasons. Some people need long walks to feel de-stressed. Some people need cycling to to feel de-stressed. So while lockdown was a good measure, why was it a good measure? Lockdowns were good measure because it reduced pollution. Lockdowns were a good measure because it prevents people from going in overcrowded spaces where lack of fresh oxygen is less. So lockdowns are necessary. It is necessary that, especially in India, where trains have like hundreds and thousands of people traveling daily to commute to work, a place like Mumbai, larger cities of India, they need lockdown so that the density of population gets reduced, so that people get to understand that they need fresh air, and they need fresh air to stay and keep their lungs healthy. They need good sunlight to keep their body healthy. Vitamin D content is needed to reduce depression. Vitamin D is also needed to help for good bone health. If your bone health is good, that also impacts many other health factors. So essentially, human beings were needing a lockdown for multiple reasons. What I realized are the reasons why they needed a lockdown was for reducing pollution, was for reducing overcrowding, was for taking the time to reflect what they can do differently in their lives to ensure that a coronavirus like condition doesn't keep on existing in their life. There are multiple reasons for coronavirus to exist and keep on existing and keep on mutating, and pollution is the number one first reason, but there is more to it than just pollution. The way Indian houses are overcrowded, the way Indian houses don't get good sunlight inside, many Indian houses don't even have good air circulation. Because of that reason also, if in case the virus is got inside someone's body, because the virus is there in the air, it doesn't need some people to come inside in the society. There were not many people coming in the society. People were only going occasionally outside once a week to go and do their groceries or buy something online and go and pick it up from the watchmen, whatever they were needing. But despite that, there were many COVID cases. So isolation was not the answer to stopping the virus from spreading, and people not contacting another human being is also not the answer. That is the antithesis of the solution, because that will impact a person's mental health as well. And right now, this wave of COVID that is going on, many mental health patients are the ones who are going to likely fall ill the most, because for 2 years now they don't have good social contact. For 2 years now they don't have people in their lives that they can communicate with or have good social life with. So and even if you are not a mental health patient, the mental health cases will arise because people are those who are anxious people, those who need a little bit of walking or de-stressing or sports or outside in nature to feel healthy, they're not getting that. Those who are social are already feeling that, and that's why they've already started experiencing a lot of other problems for maybe longer than a year. But those who are very much capable of living in isolation and who have hobbies and other things to make themselves cheerful, even they can start feeling depressed and sad and have grief over many things related to things that they didn't address for a while. So it's very necessary right now that people start addressing what is it inside in their life that needs addressing. Because if we only behave like a victim, and if we only behave like coronavirus or our government or governmental policies or other personal policies kept by our friends and family are the reason why we are unhappy, or are the reason why we are held hostage under this virus's impact in our lives, that is a false premise. That is the illusion of coronavirus. People need to realize that coronavirus can be stopped right now, right this moment, it can be stopped. But every human being has to do their self reflection. Every human being has to understand what is important for them. Every human being also has to understand deeply what are they doing in their own lives that is impacting their health, that is bringing down their immunity, and that is causing them to be susceptible to a virus, because cold and flu viruses have been existing for centuries on earth, and suddenly there is a mass emergence of this virus all across the globe, because around the globe things are happening that are not good for human health. And what is happening around the globe that is not good for human health? These are the things that I have figured out. One is people don't know how to communicate or socialize well with each other. Two is people are so busy in just pursuing a materialistic life or a life filled with just career goals. They have forgotten how to lead a good personal life with the people they love, the people they should care about. They're forgetting, slowly starting to forget about loving and caring for their kids, for their family, for their elders, for society in general, because some people may not have, I don't have kids, I don't have good personal deep connections with my family. The family with whom I do have deep connections with, they are completely in fear and lack and victimhood mentality about, and hatred mentality about the virus. So everyone is going antithetically opposite to what is needed as a solution in my life around me. But even though everyone is going around in a round and round hamster wheel of doing things that are absolutely the opposite of what is needed to recover from this virus, I have to keep going on my journey to learn more on how to combat it, so that I can help them in the future when they will eventually see the light. Because there are many people who are not able to see the light that vaccine is not a solution. There is a reason why many healthcare practitioners have quit their jobs, or are refusing to give vaccines, or are understanding why vaccines are not a solution. And the data currently shows that if you have been given vaccines, if you have even got 2 or 3 shots, despite that, if you are getting the virus, whatever nonsense they are telling you that, if you were vaccinated and that's why the vaccine is helping you be more resistant to the virus, it is all bullshit nonsense. The only reason a person is able to resist the virus is if they have been doing things that help you in preventing your body from getting unhealthy, and that help you in promoting your immunity. And if your body is doing practices, if you live in countries and cities where practices are done by not you but your neighbors and your friends and family that are impacting your health, then you will naturally be susceptible to the virus. So what are the things that I have discovered so far? I will list them here. I have written about these also in my Facebook page. You can go and check it out as well. But these are the factors that are impacting any human's health currently in society right now, right this moment, today. There are at least 5 to 10 things every human being across the globe can do to reduce the impact of earth pollution, water pollution, air pollution, body pollution. If you reduce the impact on these 4 factors, then, and also spiritual health pollution, these 5 factors, if you start practicing things that eliminate or reduce these life impacting factors, health impacting factors, then you will be either coronavirus free, or the coronavirus will come and give you a mild infection, mild flu like symptom that any other SARS-CoV-1, H1N1, H1N7, all other variants of the flu viruses have done to humanity for decades and centuries. And those human beings who don't do it, those human beings whose bodies are completely ready to pass away from this world, they will pass away, because every soul has its own journey. journey. You have to understand the spiritual aspect also of death. Death means that that person who died in one life, they had another soul purpose in their next life, and their next soul purpose is waiting for them. So that's why sometimes there are some people who got a lot of medical intervention, who got a lot of help, but despite that they died. Or some people who are highly rich, despite that they are dying. Why they are dying? One thing is that, and there will be multiple reasons for their death. The reasons for their death could be related to their family, the reasons for their death could be related to their societal conditions, the reason for their death could be related to the hospital conditions that are anti-living conditions. Their reason for death could be, and everything. Anytime a person is dying, it is because either that body itself is doing so many things and is getting exposed to so many things that the soul inside that body has decided it will be for the greatest good for that soul to pass away. But other than that, the reason why there is a greatest good existing for any soul to pass away is also because that soul dying could result in causing people around that soul to reflect that we did all these things, why did this soul die? Okay, and that reflection is necessary for society. That is why I'm saying you reflect, why is that relative who was 40-year-old dying? If you are just thinking, oh my god, this virus is impacting my 40-year-old relative and I am a 60-70-year-old person, it is going to, then how is, if a young person can't survive this virus, how will I survive? Then you are not doing the right reflection, you are not asking the right questions to the universe. You need to ask the right question. Like, I have got 3 vaccines or 2 vaccines or 1 vaccine, they are saying it is 70% effective. So why is it, why are 30% effectiveness not possible with the 1 vaccine shot? Why is 20 or 10% effectiveness not possible with 2 shots? And why are so many variants coming up? Why is vaccine not solving the problem? Because vaccines are creating a problem on earth right now. If you promote billions of people, if you promote the entire earth's population to get vaccine, if you want 80, 90, 100% of the world's population to be vaccinated, and you think that that will solve this virus from disappearing, it will not disappear, because this virus is solely existing because of earth, body, water, air and spiritual pollution of the soul. That is the reason why a virus is existing right now. These are the reasons why it is existing. There are some people, so what are the simplest solutions? The simplest solutions for making sure your body is healthy: you have to eat the healthy food, you have to have good food and good pure healthy food raised by people who are also healthy. If your food not just raised by people who are healthy, the food has to be raised by farmers who are healthy and having positive energy. The food has to be grown and packaged by people who are healthy and having a good healthy lifestyle. Then the food, while it is traveling to your home, to your retailer or wholesaler or whoever, and from there when it is traveling to your home, all these people who are carrying the food for you, their energy has to be good, their life has to be good. Otherwise, what is happening? There is energy to everything we do in life. We all humans are energetically connected by the food we eat, by the things we do, by the thoughts we have, and the energy that if a food doesn't have good energy while the food is growing, from there the problem starts. If I am eating a plant, or if I'm eating an animal that eats a plant and then gives me its meat, whatever you're doing, or if you're eating some dairy which is coming from an animal which eats the plant before it can produce the dairy, all these kinds of foods that humans consume, first things first, the plants have to be saved. If we don't save the plants that are growing on earth currently, and if we keep adding to air pollution, water pollution, earth pollution, these plants won't survive. Or even if those plants survive, those plants now have the chemicals and pesticides and fertilizers and other artificial industrial chemicals and air pollution from vehicle pollution chemicals or home chemical agents that are used for cleaning your homes. All these things pollute earth, all these things pollute the water, all these things pollute the air, and all these pollutants are going into your plants, then those same plants that either you eat or an animal eats and then you eat an animal, whatever food you are consuming then eventually has these pollutants present in it. And those pollutants, how much ever you wash your vegetable inside, if it is, I love eating watery vegetables and fruits like watermelon or oranges or mangoes or tomatoes or cucumbers and capsicum, all bell peppers, all these things have water in them, and they are absorbing anything that is coming in contact with them. They're absorbing it while they're traveling in the roads which are polluted, while they are traveling in your homes and sitting in the refrigerator, which is also a source of pollution. All these things, all these chemicals are getting laced inside the food that you're eating, and then when you eat that food is going in your body and not giving you proper nourishment. And then the humans whose bodies have been wrecked with years and years and years of pollution, they end up getting diseases. They already have some underlying morbid conditions going on in their body. They could have mental health issues, they could have physical health issues, they could have organ damage and decay going on inside their body because they have been eating all these chemically laced foods for years and decades. Then is there any reason why their body will be able to fight a virus if they are continuously, constantly eating good food, eating food that is not good and not pure and not fresh and not clean and has all these chemical pollution to it? There is going to be a segment of the population who will fall sick then, right? Because they are not eating fresh, clean, chemical free, pesticide free, pollution free food. And likewise, this is the simplest aspect. This is the simplest aspect of the food traveling from the farm to your home. But there are more layers to it. This is just the first step. You have to make sure your food is clean. If your food and whatever you are consuming daily is not clean, if your body doesn't have good clean source of nourishment going in the body, if you get 10 vaccines also, is your body going to have the immunity necessary for the body? How are antigens, antibodies developed once you get a vaccine? A vaccine, when it is injected in your body, it is a virus mimicking drug basically, and because it is mimicking a virus in your body starts a false viral attack against it. And that is why some people, when they get vaccinated, they get fevers, chills, flu-like symptoms, a little bit drowsiness, and all these different kinds of symptoms that they get, that my body aches and pains. They'll get the same kind of symptoms as they might get if they were attacked by a virus. And now, depending on the sensitivity of a person, some person might get very mild symptom and some person might get a major symptom. But it is the same thing with the virus also. The virus also, depending on the sensitivity of the body, the virus will attack some people mildly, some people majorly. And how is the body sensitivity developed? The body sensitivity, as I said, is developed by the level of pollution it is getting exposed to, the level of good nourishment it is getting. If you're getting good nourishment from your air, water, food, sunlight and everything, then your immunity is going to be good, your immune system is going to be fabulous, and when the virus enters your body, it will fight it immediately and you will hardly get any symptoms, or you will not even know that you were impacted by the virus. You will be the asymptomatic person. But again, if you're living in a city where there's lots of pollution, if you're living in a village where there's lots of pesticides being sprayed all around the year, if you're living in a town where every time there is a mosquito problem or a pest problem, they are spraying pesticides all around, you are also inhaling the same pesticide. And the pesticide that can kill a 1-inch cockroach or a 1 millimeter or 2-3 millimeters mosquito or any other pest, will it not harm at least that 1 millimeter, 1 inch aspect area of the cell of your body. It has every potential to harm 1 inch area, 1 millimeter area of your body as well. And while it is harming your body, those who are now super sensitive to such things, they will immediately show some symptom. They will have skin rashes, they will have breathing distress, they will have irritation of the skin. Some people might even have psychotic episodes, because these things, when you're inhaling it directly from your olfactory nerves, can send some signals to your brain, which can impact your brain function as well. So there are multiple reasons, and if these are very easily absorbable blood brain barrier penetrating chemicals, they will naturally go into your brain. There are many, and these are usually blood brain barrier crossing chemicals only. That is how these pesticides and pests work. They are either going to kill the nervous system of these cockroaches and insects, or they are going to cause something, a bleeding inside them. Like rat poison is that. Rat poison crosses the blood brain barrier, causes brain bleeding and bleeding of the rats, and that's how rats die. So all these pesticides are heavily toxic things that cause organ damage, cell damage, insect damage. A big rat also, like a rat is what, 120 grams of a rat can die, 120 to, I have done experiments with rats, so I know rats and mice, they can range from 50 grams to 200, 300 grams in size. So if that size animal is able to die from consuming these pesticides and from coming in contact with these pesticides, that a rat's size is equal to the size of your brain or your heart or your lungs or your gut or your uterus. So imagine you're exposing yourself every time some society does pesticides. They are exposing every single human being of that society to a one organ damaging perspective now. They are doing that every time. And just because our human bodies can be resilient, just because there are people who are able to fight these all, how, if they are doing meditation, if they are doing other health boosting activities, like reducing their stress levels, doing mindfulness practices, trying to ensure that they don't get too much exposed to pesticides, if they are eating a little bit less of the foods that have pesticides in them, and more of and are very and aware of what foods have pesticides, what foods have chemicals, and what foods are cleaner to eat. If they're doing that, then obviously that person will sustain longer, versus a human being who is completely not paying attention to what is going on, is completely polluting the environment in their house, in their society, in their neighborhood, and continuously inhaling the air related to these pesticide contamination or vehicle pollution contamination or industrial contamination or construction dust contamination. These are the things I have seen in India. There are mosquito repellent spray or hair spray and car sprays, air fresheners. All these things are continuously polluting your air, polluting your lungs, polluting your respiratory tract, polluting your brains and organs. And then if you have a weakened immunity and get the coronavirus, who are you blaming? Why are you blaming other people who didn't take vaccines? The ones who didn't take vaccines are adding to the earth's pollution reducing initiatives. Because if you are keeping on promoting vaccines, you are promoting what are you promoting? As a person who is from the pharmaceutical industry, I know the 20-30 different things that you are promoting, the manufacture of, distribution of, and then after the injections have been given and all those disposable needles and syringes, they have to be burnt, or something has to be done to dispose of those garbage that was generated as a result of giving vaccine to certain human beings. And all that earth garbage that was now generated, how are you going to dispose it off? If you bury it inside the earth, do you have enough space on the earth? There is not enough space on earth right now for billions of human beings. That's why we have high rise buildings existing in highly populated cities, because people can't even live closer to earth right now in densely populated cities. And in those same densely populated cities, densely populated countries, if you are promoting vaccine production, and if you are promoting vaccine injection and then disposal of those vaccines, now you have created a huge amount of waste which needs to be managed. And the fastest waste management in such countries is by burning them. If you burn them now, what is going to happen? If you burn these syringes and if you burn these waste, you have now added to the air pollution. So who is now responsible for the coronavirus in your country and society? Are you responsible or not responsible by taking measures that are not fruitful for your society? Same thing with any other city that is now dealing with the after effects of vaccine promotions, because there is a huge amount of earth pollution that you have generated. Not just vaccine promotion, the disposable mask promotion, the disposable gloves promotion, the disposable small sanitizer vial promotion, all these plastics, all the plastics plastic syringes, and even if it is not plastic syringes, the glass vials, the glass syringes, the metal needles, the plastic gloves, the gauze pads, the plastic or paper pouches for your alcohol swabs. There are millions of things. There's at least 10 different things as a pharmacist, I have given a vaccine. That's why I know that earth pollution that was getting caused when I gave only 200 patients a day, or 100 patients, not 100 patients a day. I gave maybe vaccine to 1 or 2 patients, but there was a 3 to 6 month span when I gave vaccines to patients. The other pharmacist was also giving vaccines to patients. So our pharmacy generated at least a kg, 2 kg of earth waste based on the vaccines that were disposed. And this was in the time when there was no pandemic. This was in the time when US used to promote flu shots, but there were only maybe 50% of the US population was getting the flu shot. Now if you want 100% of the US population to get a flu shot, or not just one flu shot, you want them to take 2 or 3 flu shots, you have now increased it by many degrees. Depending on if you're asking them to take 3 flu shots, and from 50% of the population you want 100% of the population to get the flu shot, you have doubled up. And then after that doubling, you are now again exponentially adding on to the problem of earth pollution that will be generated either in your country or in some other country, either in your county or in some other county. And then which counties, the poorer counties of US are only going to get because they don't have any income, they don't have any other source of income. What are they doing? They are probably accepting waste and garbage in those areas, and those landfills are getting filled up. Then from those landfills, whatever the garbage is going to stay there for years and decades. Eventually, something or the other will happen, and some biodegradable biological waste is burned and incinerated because they are biological waste. So people have to think, why are they promoting a solution when easier solutions are available? You do pranayam, you do, physiologists have also given different breathing exercises to make sure that anything that is just entered maybe in your nasal stream, if daily every human being takes one every with every hour, if for 2 minutes people do some good breathing exercises to expel out anything that is entering their lungs, they will have a good healthy body also, because the pranayam exercise or physiotherapist recommended breathing exercises are great ways to expel out any germs that might be entering your system that are not getting caught by your mucus of mucal passages. Okay, because our body already has a design to prevent virus from entering our body. Our nasal passages have mucus in them, which helps it in preventing entry of viruses. Now, but if you are asking human beings to wear masks continuously, where is the problem with wearing masks continuously now? Those people also need good air, good water. You're telling people, if you're going out in society, you can't breathe fresh air, you are breathing your own germs again, constantly. So if any bacteria also was there in your body, that is not getting dispelled because you're wearing masks all the time. This bacteria that didn't get dispelled, now that is going into your gut, that is impacting your gut health, that is impacting gut health, is also related to mental health. There are many reasons why even mental health is coming up. That's why there are some sociological reasons, there are some physical reasons, there are some biological reasons, there are some coronavirus fear created reasons. So masks are also not necessary. What is more necessary than masks? Masks are only necessary if you are in seriously overcrowded places, and if you are really fearful that whatever you are doing in your life is going to give you a disease. Because if you get away from the fear of whatever you're doing in your life is going to give you a disease, that will help you. If you get away from the stress of whatever is happening with the coronavirus is going to give you disease, that will give you another degree of protection. If you remember that, sanitizers and masks are not the solution, that will give you another level of protection. And if you start doing breathing exercises, if you start leading a healthy life, if you start eating good food, clean food, if you start promoting that, your society starts promoting growing of green vegetables and herbs and plant products that will aid your health, then there are many immune boosting herbs and spices that are existing in the world. There are many Ayurvedic drugs also that have been developed, that have been shown observationally to be beneficial in helping people get free from coronavirus. And those people who were able to get free, they also live in a village, they also live in a clean and green village. That is a secondary factor that is impacting their good health. So yes, herbs will help you, medicine will help you, there are many things that will help you in getting recovery from the virus. But if you don't want to get the virus, you have to insist that society starts doing things that prevents earth, water, air, body pollution. And these are the first levels, these are the first preventative levels, these 4 steps. Then also you have to do mental cleansing, mental health cleansing. You have also got to do some spiritual cleansing, because if you consider, this is like modern untouchability that is happening in India. There was untouchability that used to happen many years back. And I'll talk about Indian history and untouchability right now. Why? Because there is a big parallelism happening with coronavirus and coronavirus related isolation of people. And in the olden times in India, first, if people are not aware about Indian caste system, there were 4 main castes that were thought to exist in Indian culture. And when those 4 castes were formed, 4 main castes, and then there are many subcastes. The first caste were I'm forgetting the order of the caste, so don't judge me for forgetting the order. But the first caste were people who were the priests and the doctors and all, and they would pray and for good spiritual health, societal health, and they would also heal people. These were the first top class. Then the second class were the soldiers and the knights who fight, and the kings who are the rulers of the society. Then the third caste were the businessmen of the society who are traveling around and doing business and selling things, and that was the business class. Then the fourth class were the class of the poor people, who are the ones who in that fourth class who were doing all the backbreaking laborious things like sweeping and knitting or sewing or other lower class things like cleaning of drains, and they were acting as your maids and maybe farmers and all these things. They were the lower class people. And in these lower class people, the untouchables became the class who were doing the cleaning of the drains and of all the ones who were doing all the cleaning activities. They were considered the untouchables. And okay, there is this reason why people started fearing them or didn't want to touch them. And what is the reason why people were doing that? Because now, say a human being is handling a lot of germs, those people have developed immunity against the germs because they are constantly working with germs, constantly exposed to germs, constantly washing like unclean dishes of people, constantly cleaning up the drains and other sewage systems and everything of a society. So these people, they might be the garbage collectors also. Now these people are constantly exposed to germs, and because they're constantly exposed to germs, they have an immunity to the germs. But the higher class people who are not exposed to germs, who don't even touch dirty dishes, who have hired servants to clean for them, cook for them, these people, now what has their system developed? Their system has developed a sensitivity towards germs, and because their sense system has developed a sensitivity towards germs, they are hyper aware of those humans who have a lot of germs existing in their body, and because they have a sensitivity towards germs, they don't want to touch and interact with these humans who have a lot of virus inside them. Okay, this was the reason why untouchability psychologically and socially started existing, and then slowly over time there was an easier solution to this. The easiest solution would have been if the societal structure had broken down, if people were mixing and mingling, and that is what eventually evolution did. That evolution eventually did that thing where people started, initially there was a cut to cut caste system and people were not marrying outside their caste, but slowly over the centuries people started marrying outside their caste, and that's how intercaste marriages are allowed, and further breakdown of these policies were needed. Why was it needed? It was needed for a person to have both the genes. It is needed for, if you want to have superhuman abilities, one part of superhuman ability I would think against germs is a person who is born from parents who have a higher caste parent also and a lower caste parent also, because if you have a higher caste and a lower caste parent as in your ancestry, in your genes, then what will happen? That human being will not only have super resistance to multiple viruses and bacteria and diseases, that human being will also have sensitivity towards understanding when viruses and diseases are existing in the world, when certain conditions are existing that don't need to exist, so that you prevent the viruses from even perpetrating in the world. You will have both the genes. So those type of people are necessary. The society needed that, because society needed that medicine should stop being the evolution needs, that medicine is not the only cure for diseases, and that secret has been known for centuries and decades, and in every society. That's what was there in the ancient history of be it Chinese civilization, be it Indian civilization, be it Egyptian civilization, and Native American civilization. They all knew this. That's why they used plants and animal extracts to help with healing paradigms, and they used shamanism, medicine, meditation forms, Tai Chi, Qigong, other kinds of energy healing. These are all existing. Even the chants that the priests say in the Sanskrit language, those chants also have a healing power to them if a powerful healer chants them. If you're just mindlessly chanting a Vedic hymn, then it will not cause any healing. Then you're just mindlessly chanting, because you're not understanding the inner, deeper vibrations of those words. But if someone chants them soulfully, with their heart, with their soul, with their mind, body, soul, those words can be absolutely healing to another human being. And this is what energy healing is. This is what sound healing is. This is what frequency healing is. It is all the basis for healing someone's body from diseases, and those kind of healers exist. Jesus himself was a healer like that. That's why he could heal people, and not just Jesus. After Jesus, there are many other healers who have come on earth who can do that via either their different mechanisms, because everyone has a different kind of healing property, and you can even develop in yourself the self-healing capacity by doing the right kind of things that enhance your body's health, society's body's health, your family's body's health, your other planetary creatures' health, because everything is interconnected. So every time a lockdown is happening, instead of fearing or worrying or being anxious or feeling depressed, start reflecting, what can I do in my life that can reduce the impact of earth pollution? And if you have found the solution, found the answer, start doing it. Lots of people have already realized it. They are already talking about it. They are already writing about it. They are already speaking about it. Now it is up to you to understand whether you want to follow those people who are showing you the way, showing you the light, trying to help in the way they best can, because there are certain people who awaken to the reality that medicine is not a solution many decades previously, and those people have already developed many meditation programs, energy healing programs, other earth healing related programs and systems. They're developing, they've already developed, they're improving those systems. Now it's up to you whether you want to believe in those teachings, if you want to inculcate those teachings, or if you want to keep existing in a medical based, vaccine based paradigm, which is adding more to the coronavirus problem than solving it. And every time a person, any doctor should really start thinking and reflecting, not just doctor, any healthcare professional who is being forced to give vaccines and to patients, or any government who is wanting to force vaccinations on its patient population, needs to start reflecting what is the health versus health risk versus benefit to promoting a vaccine, to giving a vaccine. If you are not doing that reflection, or an individual, either you have to do city by city basis, patient by patient basis, or country by country basis, different kinds of system needs to be in place to understand if the vaccine is necessary for a particular patient population. Just saying one size fits all is not going to work. One size does fit all, which is energy healing, but many people are not ready for that newer form of solution that has emerged already and has been emerging for a while. So until you go there, there is another solution, which is taking some Ayurvedic drops to heal yourself if you get impacted by the virus. But apart from that, everything else that has been getting promoted by society for the last 2 years as a measure to stop coronavirus, 50% of it is all false information. 50% of it is not going to help you. You have to definitely use your judgment. If earlier a human being was going 10 times a day to 10 times a week or month to go and do grocery, definitely reduce your grocery shopping to once a month. That way you will reduce the travel time to doing grocery for like the big items that you need. You can order all those items once a month. But the ones, if you're using like vehicles to go and get it, or if you are using some, I will talk about these solutions also. Simple solutions. These are very simple solutions. Everyone can start doing it, and to reduce the impact of the virus in their own life, because the virus will stop existing if air pollution stops existing. Virus, at least some viral variants will stop existing. Then some other viral variants will stop existing if pesticide contamination from food stops existing. Other viral variants will stop existing if people start improving their spiritual and mental health. Other viral variants will stop existing if people start interacting and stopping this untouchability like mentality that is arising, that this person who is delivering, I don't know whether the virus could come from this person, that's why I am going to sanitize everything that this person touched when he delivered something at my home. That is the ultimate ridiculous thing. Or every time I'm going outside and I'm coming home, I'm going to wash everything in soap, and I'm going to sanitize my hands and everything. Why? That is also a false premise. Because if you were outside and the virus fell in contact with you, it is not going to impact you if it fell on your clothes or your hand. It is only going to impact you if you inhaled it. And after inhaling also, it is only going to impact you if your body has a system ready for a virus to grow. If your body is doing a lot of healthy measures, physical, mental, emotional, spiritual health measures that are like keeping you in the top of the game, then you're not going to get impacted by it. Or even if you get impacted, you will fly by the disease in 2 days or 2 weeks. It will not cause any harm at all. Okay, and why sanitizers are really harmful for you? It is the alcohol based sanitizer. Even if it is alcohol based sanitizer, that I still can understand if you're using it minimally, occasionally, in areas where if you need to eat food, or if you're needing to do something where if you're a doctor working in a hospital. But even, there is a history of even doctors in a hospital use hand sanitizers continuously. Okay, those who work in the emergency room have to constantly use hand sanitizers when checking a patient. Not just doctors, nurses, or anyone who's coming in contact with the patient has to wash their hands and has to use hand sanitizers. What is happening in those hospitals? We have a well-known studied history of hospital-acquired infections happening to patients. Why are they happening to patients? Those patients who are in the hospital and are severely ill and are hospitalized, they already have a reduced immune system. That's why only they are hospitalized. Their body is not functioning at an optimal level. And because their body is not functioning at an optimal level, because some organ damage or something else is going on with them, their immune system is naturally going to be down as well. And that's why every time, but people around them who are using sanitizers, their body, what is happening to their body? Every time you use antimicrobial, this is also very well known data, antibiotics, when antibiotics are used for a long term, antibiotic resistance bacteria and other fungal and other microbial infections can happen in a person's body. This is a studied data. Okay, and so these doctors who are using sanitizers and effectively, constantly, regularly, their hands are, all the good bacteria in their hands are going away. And then all the good bacteria in their hands are going away. Then what is happening to them? Their body is susceptible to any other microbe that these good bacteria could have combated. And as a result, these people are now existing with fungal infections or viral infections and other things that they are not aware of. But any other patient that they come in contact with now, whose body has a low immunity, will naturally pick up that infection from this doctor and or a nurse or whoever comes in contact with them, and eventually these patients are getting hospital acquired diseases. So see, sanitizer use is not beneficial. Sanitizer overuse is in fact causing every human being now who is using sanitizers at home daily, constantly in coronavirus panic. If they have been using it daily, constantly in panic, what they have been doing is they are bringing a system into existence where other microbial infections will exist in your body. And as soon as your body has been exposed to some other microbe, then what is happening? Then your body is already fighting one infection. Say, there is some fungal growth happening in your bathroom, or if there is some mold growth happening in your kitchen, and exposure to the mold in your bathroom or kitchen has caused you to have an underlying undetected mold infection or fungal infection going on. So your body is already, the immune system is fighting this mold and fungal infection, and at that time if a virus is attacking you, obviously you will get a disease. How much ever you get you have been injected by a coronavirus anti-vaccine, even if you have been injected by a vaccine that is supposed to help you with the virus, your body's immunity is the only thing. Your societal condition, your living condition, your psychological condition which makes you wash your hands 10 times with a sanitizer is going to determine your health. If you're washing your hands 10 times with a sanitizer, 10 degrees of problems you're creating for yourself. If you're washing your hands occasionally with a sanitizer, then you have reduced your problems. And if you don't use sanitizer, I don't use sanitizer, I don't go out only, I hardly use sanitizers. I maximum use sanitizers occasionally, very occasionally. I have only been using soap, because only you need when you go outside and come back home. That is the practice I have been following for years and years. Wash your hands, wash your feet, change your clothes.
That is the only cleanliness based practice we had been following for decades and decades. And in fact, for a while during the pandemic, I was completely sick. I was getting sick from detergents in the market. And because I was getting sick from detergents in the market, I was not able to, I didn't wash my clothes with soaps also. I was just washing my clothes with salt solution. Salt was an excellent cleanser. I was either using salt solution or using, sometimes toothpaste seemed to have a little lesser degree of contamination and pollution in them, so I was using occasionally toothpaste. I was using natural remedies to clean my body also and clean my clothes also. That's all I was doing. And no sanitizer or very minimal. I used sanitizers only for the first 5 months when the sanitizers in the market were the white sanitizers, were the unscented sanitizers, uncolored sanitizers, unpolluted sanitizers. And as soon as those sanitizers went away from the market after the first 4-5 months, whatever else came up in the market, they were highly pollution creating to the body. My body was highly sensitized to pollution because of an underlying thyroid lesion progressing into causing me thyroid storm, which is very similar to COVID storm. I also had got a COVID-like symptom long before COVID lockdowns happened. But at that time, those symptoms were not considered as COVID symptoms. So I can't confirm or deny that whether I got COVID or I didn't get COVID. But all I know is, even if I didn't get COVID, I got some severe flu which had brought down my immunity. And because my immune system was down, my lungs were sensitized to any kind of pollution that I was inhaling. My skin was also getting sensitized to a lot of pollution long before COVID started. Like almost a year before COVID started, my skin was getting sensitized to the air pollution, dust particles inside the house. So all these things happened. I did the test for all these pollution that was happening to my body almost a year later after my pollution problems, after these pollution problems started in my body. But my body was that's why sensitized. I was getting heightened immune, my immune response was high, my immunoglobulin levels were high, and because of that reason, anytime some toxin was coming in contact with my skin or toxin was coming in contact with my lungs, I was detecting a problem. I have tried to convince my family to not use these things, but you know what? People will only listen when they are convinced internally. So here in these videos also, I'm trying to post these things, or even in my written posts on Facebook, I'm trying to do these postings because I want people to understand what is underlying condition that is impacting their health. If those underlying conditions are removed, then you will be in the peak of health, and the virus also will stop existing if people start doing some of these things, stop doing these things that I am mentioning here that are causing people to have breathing distress, causing people to have skin irritations and allergies, causing people to have weakened immunities, causing people to have susceptibility to other infections. Because when you start getting susceptible to other diseases and other disease conditions, your body's immunity is naturally down, and when it is down, then it is more likely to get susceptible to the virus. On the other hand, if you're doing practices that enhance your body's health, that help your body's immunity, that aid you from living a clean, green, pollution-free, sustainable lifestyle, then you will be the ones who will ace this virus and nothing will happen to you despite whatever else is happening outside you. Because if you're doing energy healing, that is really the way in which you can create like a complete immunity against the virus. Like you can create your own bubble around your energy system, because this is my energy system. From my energy healing class, I know there are people who can create like this boundary around them which will prevent any kind of toxic energy from entering the body. A virus is basically a toxic energy system entering my body, so I can prevent a virus or any other chemical from entering my body as well. I haven't developed that capacity yet. I know the technique, but in order to develop it, it will take time and practice. But I have been developing some time and practice. That's why I'm living in a highly polluted house right now with high levels of pollution around this area. In my house, I try to grow 3-4 different plants, and of which only one plant is existing in this area, despite the pollution, because the other plants are not able to sustain this level of pollution here, and they're dying. I have a tulsi plant which died, which anyways, in winter time it is hard for a tulsi plant to survive. But apart from the winter conditions, the pollution long before winter arrived, it was not sustaining in the polluted water that I'm giving to this plant. But the other plant and I am not using any filter, also water filter nowadays. I use only a minor filter to take out big filter particles. But I'm also kind of surviving despite this high level of water pollution also that's going on, because the society and the nearby societies are using chemicals and water pollution agents that are polluting the water supply. And despite repeated requests that do not pollute, nothing is happening, because again, unless people start awakening to the reasons why they are falling sick, these things are not going to stop. And unless people stop doing these things, coronavirus or other conditions that are impacting a person to fall sick due to a virus will be hard to remove from society. And every society is doing multiple things that is causing health problems. They have to reflect, every family is doing multiple things that is impacting their family's health. So if in your family right now, in your household, one person is sick from coronavirus, you have to start reflecting why you got sick, what are the health conditions that are causing this. I have clear cognizance, I have scientific information, I have clear alliance, I have some sixth sense abilities, as well as three-dimensional educational abilities, which have given me the insights necessary to understand why a particular family, or why I feel sick, or why my family is falling sick, why my friends are falling sick. I have tried to dispense that knowledge, but only now I'm dispensing it in the public, so that publicly, if people are looking for a solution, they will contact me and ask me for the help that they need, and I will be glad to help find out and figure out with you what is going on in your life that is causing you to have a weakened immunity and poor health, or that can impact you or your family to have coronavirus in your life. So do contact me and email me if you found this video educational and informational. Thank you. Bye.